Hello, my name is Karen Blake and I'm an Indiana State University nursing student. And today I'm going to talk to you about a population at risk, which is the LGBTQ community. My learning objectives for this presentation are: students will be able to define important terms relating to the LGBTQ population. Students will be able to list specific health risks for the different populations within the LGBTQ community. Students will be able to describe healthcare disparities for the LGBTQ population. Students will be able to explain ways we can improve healthcare for the LGBTQ population. And students will be able to describe any potential prejudices they may have against the LGBTQ population and explain how that could affect a patient's healthcare outcomes. Please take a moment to click on the link below and take the pretest. There are many terms within the LGBTQ community. There are a lot of terms on this page, and I will go over some of them with you. An ally is someone who is supportive of the LGBTQ community and someone that they can feel safe around. This could be someone outside of the community as well as within the community, such as gay men supporting transgender persons, lesbians supporting gay men. It can be both outside the community as well as within. Biphobia is having a fear of or a dislike of those attracted to both sexes. Coming out is the process of accepting one's sexual preference or gender identity and sharing that with others. Gender expansive describes persons with a wider view of gender expression than just two, male and female. And gender expression is how someone expresses and shows their sense of gender identity with what they wear, how they act. Gender fluid describes someone who may not associate with just one gender all of the time. Gender identity is how a person identifies their gender to be. It could be male, it could be female, they could be, as we spoke of, gender fluid. Homophobia, most people know already, the fear of, the dislike of, discomfort with those who are attracted to the same sex. Intersex is someone or persons who are born with different or potentially mixed sexual traits and anatomy. Pansexual is similar to bisexual. It's someone who doesn't have a necessarily specific preference for gender in relationships, but they can be attracted to someone regardless of their gender or gender identity, and not necessarily at the same time. Queer is a term that used to be used in the past as kind of a slur towards the community. However, within the community, it recently has been embraced and will use it within themselves. Transgender is someone who identifies as the opposite sex, and some go through processes to change so they can more physically match the gender with which they identify. Transitioning is the act of going through different processes to better match the gender with which someone identifies, and it could involve acts such as dressing differently, having surgeries, taking specific medications, and or changing their legal name. There are many health risks for the LGBTQ community. They are at a greater risk for HIV as well as other STDs. Gay men, and even more so gay men of color, are at the highest risk currently. This community is at a greater risk for mental health disorders as well as suicide. One of the saddest statistics is that 50% of transgender adults report suicidal ideations. This is true for LGBTQ youth as well. They are much more likely to be depressed or attempt suicide. This community is at a greater risk for breast and cervical cancers as well. Lesbians and bisexual women are less likely to have regular screening for these cancers. The community is at a higher risk for heart disease. They're more likely to abuse tobacco and alcohol and more likely to experience high stressors, which all contribute to heart disease. The community is at a greater risk for obesity and eating disorders. Gay women and bisexual women are more likely to be overweight or obese. The community is also at a greater risk for substance abuse. This happens often because of increased stressors that occur in their life. There is often bullying in their childhood as well. Something that we really need to change is healthcare insurance. Members of the LGBTQ plus community are much less likely to have healthcare insurance. Often, healthcare insurance provided by employment also does not always cover partners or spouses of the same sex. Not all health insurance will cover gender reassignment surgeries either. In addition to these issues, members of the community do not always want to discuss their sexual preference to their healthcare providers because they feel they might be judged and they are much less likely to feel comfortable seeking care. All of these factors can lead to LGBTQ plus community members not having the access to the care that they need when they need it. Our medical education definitely needs some improvements regarding this community. Many physicians and nurses have received zero training in their education regarding LGBTQ plus needs and providing compassionate care. Medical students that have been surveyed reported having inadequate training on transgender care. A survey given for doctors, nurses, and dentists revealed 79% of these providers were interested in more education regarding this community's healthcare needs. A transgender survey just done in 2015 showed that 33% of transgender patients had a very negative experience when seeking care. Some reported harassment and some reported refusal of care. 23% of the participants did not seek care over the course of the year because they were worried that they would be mistreated. So how do we make these positive changes? I think that medical and nursing schools should include at least a unit, if not a mini class, for LGBTQ plus centered care. For medical professions who are already in the field, there should be required continuing education yearly. Even better would be an in-person class taught by someone who is in the medical field but also a member of the LGBTQ plus community. Including resources in the end of visit handouts for those in the community would help them to know where to turn for help as well. It would also help them to feel included. It is time to revolutionize care. The Mayo Clinic founded a transgender and intersex specialty clinic, and at this clinic, patients can access a multitude of specialties in just one safe space. Providers are trained to be competent in care for the transgender population. They have offered us these tips. Talking about the patient's gender nonconformity is good, but make sure to do so in a non-judgmental way. It is so important to open up the conversation so the patient feels comfortable talking to their healthcare providers. Asking the patient what their preferred pronouns are is very crucial. This should be included on the intake form as well if you have one. Try to make sure in your clinic there are unisex bathrooms. Public restrooms can be very stressful for transgender patients who are worried about being called out by others. Now it's time to take a minute and face our own fears, our own prejudices, and our own ignorance. In order to fully support the members of the LGBTQ plus community, we also need to look at the way that we feel towards them. We need to examine the way we present ourselves for those of us who are medical professionals when we take care of them. Sometimes it helps to put yourself in someone else's shoes. Imagine that you had something or that you were something that made you embarrassed or scared to seek out healthcare, and you didn't know who you could trust or who you could confide in. What are some things that the person taking care of you could do to make you feel included and to make you feel safe? Think of some ways that you can change your practices or interactions to be more inclusive. Some things are to ask for preferred pronouns, to wear an ally pin, and to refer to a person's significant other as their partner rather than assuming wife or husband.